To obtain a 12-lead ECG, power on the defibrillator and insert the precordial lead attachment into the main ECG cable. Prep the skin and place the ECG electrodes as previously described, but at the following sites. First, the limb lead electrodes are typically placed on the patient's wrists and ankles. Place the right arm electrode near the wrist on the inside of the patient's right arm. Place the left arm electrode near the wrist on the inside of the left arm. Place the left leg electrode on the inner aspect of the left leg near the ankle, and place the right leg electrode near the ankle on the inner aspect of the right leg. Although they can be placed anywhere along the limbs, do not place the limb lead electrodes on the torso when acquiring a 12-lead ECG. Next, place the precordial leads 1 through 6 on the chest. Accurate placement of these leads is critically important. Practice finding the landmarks on yourself and others. The electrode placement for precordial lead 1 is in the 4th intercostal space to the right of the sternum. To locate this position, place your index finger in the notch at the top of the sternum. Move your finger down the sternum until you feel an elevation or thickening of the bone. This is the angle of Louis, where the manubrium joins the body of the sternum. Move your finger down and to the patient's right into the depression between the 2nd and 3rd ribs. This is the 2nd intercostal space. Move your finger down the right side of the sternum 2 more spaces. You have located the 4th intercostal space. Apply the V1 electrode. Move across the sternum to the 4th intercostal space on the patient's left side. Apply the V2 electrode. Precordial lead 4 is located next because it is a reference point for V3. V4 is located in the 5th intercostal space at the mid-clavicular line. Find the 5th intercostal space by palpating for the intercostal space below the V2 position. Then follow this space with your index finger laterally to intersect with the mid-clavicular line. Place the V4 electrode at this point. Place the V3 electrode directly between V2 and V4. Place the V5 electrode level with V4 at the interior axillary line. Place the V6 electrode level with V5 at the mid-axillary line. When performing 12-lead ECGs on female patients, place the electrodes for leads V3 through V6 under rather than on the breast. Once all the electrodes are applied, encourage the patient to lie still. It will take a minimum of 10 seconds for the monitor to acquire a 12-lead ECG. Press the 12-lead button. The 12-lead age menu appears. Enter the patient's age with the selector. If an age is not entered, the 12-lead automatically selects 40 and begins acquiring the 12-lead ECG. The monitor acquires, analyzes, then prints the 12-lead ECG. The LifePak 12 defibrillator monitor is configured to print the 12-lead report in the 3-channel format. Standard 4-channel and Cabrera formats are also available. Consult the operating instructions for more detailed information about these formats. If the monitor detects a noisy signal or ECG leads off condition while acquiring the 12-lead ECG, the message noisy data, press 12 lead to accept appears. Check whether the patient is relaxed. Ask the patient to lie quietly. Check electrode contact or reposition lead wires to eliminate the signal noise. The monitor resumes acquiring the 12-lead ECG as soon as the signal clears. If you are unable to clear the noisy data message, press 12 lead a second time. This forces the monitor to acquire the data in spite of a noisy signal. Any 12-lead ECG reports acquired in this way are annotated with the message ECG override, data quality prohibits interpretation. For more information about troubleshooting ECG noise, request a copy of the LifePak 12 Bulletin about ECG bandwidths and ECG troubleshooting. Precordial lead electrodes and lead wires can interfere with the placement of standard paddles or therapy electrodes. Before defibrillation, remove any interfering electrodes and lead wires. This concludes the Acquiring a 12-lead ECG section of this video.